Welcome to the Jeff Crilly Show. And now, here's Jeff Crilly.
Welcome back to the final segment of the Jeff Crilly Show. I just love her name. Her name is Dr. Farah Khan. It just kind of like floats off the tongue. Dr. Khan, you are really, I described you in the break as the reigning queen of cosmetic and plastic surgery here in Dallas. But you didn't wake up as a little girl and say, I want to be a plastic surgeon, did you?
No, I didn't. If you ask my dad, I played a lot of video games, and he's convinced that my hand-eye coordination developed from playing Duck Hunt, and that's really why I went into plastic surgery. But I love doing things with my hands, it was fun, And so when I went into medical school, you pretty much go through all the rotations. You go through medicine and pediatrics and surgery was just cool. I mean, it was very long hours. But I was always doing something, and I kind of got to see the immediate result of my actions, and that was the best part, and that's really why I went into surgery.
Well, I think, Dallas, if it's not the capital of plastic surgery, it's right up there with L.A., New York, and Miami.
Yeah, it really is. We definitely do see a lot of cosmetic patients, and I think a lot of it is because of the Dallas Cowboys cheerleader. It's kind of the ideal female look, and a lot of women want to kind of look like that.
And some people listening to this might be scared of plastic surgery because you always see those tabloid stories about the Hollywood star who had a botched plastic surgery. There's an art to doing it right.
There really is. We've always found that typically the less you do, the better off it is. I think when people are looking for like an extreme change or an extreme makeover, that's when you can tell, and that's typically when it isn't a good result. So the best plastic surgery that we find is when people can't really tell you actually had surgery, but something just looks different. You look a little bit more refreshed, you look a little bit, just younger.
Yes.
And that's it.
And do you also talk patients out of, like, let's suppose somebody wants breast augmentation and they're suggesting 2 or 3 sizes too big? Do you talk them out of it?
We do. And I think that's my job, right? I mean, I trained for many years, and I know what's going to be good for someone long term, medically, what's going to be sound. And so, that really is my job. And we do a 24-hour recovery breast augmentation, and it's actually based upon the fact that we do measure you, and we only put in implants that actually fit your breast pocket. And so they should be your ideal size.
What are some of the trends, if you will, in cosmetic surgery these days?
So, we've definitely seen a big increase just in the non-invasive aspect of plastic surgery, and so Botox has, dramatically increased. Fillers, and there's new fillers that are coming on the market like Restylane Define and Refine, which kind of changed the game. And then Kybella recently, which just kind of dissolves away the fat. So right now it's approved for use in the submental area or underneath the chin, but it should probably be expanding some of its indications. From a surgical point of view, I think people have now really accepted kind of the weight loss surgeries. And so a lot of people, after losing 100 pounds, 150 pounds, need a breast lift, or they need a body lift, or they need a tummy tuck. And so those surgeries have really increased in popularity as well.
It must be really rewarding to you when you do just like a perfect job, huh?
Yeah, it really is, because you change someone's life. And it's really neat seeing them the day. We typically see our patients a day after. And so, even though they may be sore, they're in pain a little bit, it's really cool seeing the smile on their face because they can see the results already. And even though they may be a little bit swollen or whatever, they see how it's going to impact their life. And then you kind of follow them, you see them at a month and 3 months and 6 months. And it's really neat just seeing that confidence develop. And it's like seeing a whole different person walk into your clinic.
Talk about the homework that is necessary to pick the right plastic surgeon, because we've all heard horror stories of people who, they were a dentist and then they took a weekend course. And
yeah. And the sad part is those people are out there. So if you are an actual board certified plastic surgeon, that means that you've actually trained in plastic surgery. And so that means you either did a 6-year residency in plastic surgery or you did general surgery followed by a plastic surgery fellowship. And then in order to become board certified, you have to take a written exam and an oral exam, and you become board certified by the American Board of Plastic Surgery. which is the only board that's actually recognized by the American Board of Medical Specialties. So when people say, well, I'm a cosmetic surgeon, they're not really trained in plastic surgery. Their boards are different. They're not even recognized by the American Board of Medical Specialties. So it really is important, if you're looking for plastic surgery, find an American Board of Plastic Surgery, board-certified plastic surgeon.
And I know being a female plastic surgeon does have some advantages.
It does, sure. You know, I think it's easier for me to just connect to women, and it's a lot easier for women to come into my office and just kind of talk about, you know, what bothers them. I also, I think, understand what their issues are because I'm a female as well, you know, so we all want to look good. We all want to, you know, wear the newest fashion trends. And so I think it's just easier. And I think I found that with breast augmentation, right? Like a lot of women, when they initially come in and they say, well, I want these huge implants. Well, if I sit down and talk to them and it's like, well, hey, you know, if you do get huge implants, how are you going to, you're a size 2 on the bottom, how are you going to fit into a size 2 top? You're not, you know, and it's things they haven't thought about. And then it's like, oh, okay, yeah, well, maybe then my breast size should be proportionate to the rest of my body.
You almost become a therapist, don't you?
You do. You really do. I mean, and I think it's very important because 50% of the people who walk in through our clinic we will not operate on. And the reason why is because they either have unrealistic expectations or they're doing it for the wrong reasons. And so you want to make sure that the people who come in, they really do want to do it for themselves, not because of a family member, not because of a spouse. And also, you know, that their expectations are in line with reality.
So how do you see your practice growing in the next few years? I mean, with millennials, it's been said that they're the selfie generation. They're looking at themselves all the time on social media, and they're seeing one. Even Sarah, only 27 years old, is like she'll squinch up her forehead and say, "Look, I've got wrinkles."
Yes. It's preventative, right? Botox is preventative.
It's all good. I know, and I think Sarah wants some Botox. You know, I think we really do live in an age where we're always documenting ourselves. We're always taking selfies, we're on Snapchat, we're on Instagram, and so people want to look their best, and there really isn't anything wrong with it. You know, we do Botox all the time. I mean, even in men, recently, I think we've seen a trend, and a lot of men just want that competitive edge. So let's say if they're going in for a new job interview, they just want to look their best, and I think that comes across then in their confidence.
Well, I heard it once that reality television and just the TV shows that are popular these days are conditioning us not to get gray or get old. Because, you know, when I was growing up, you had the Waltons on TV or Sanford and Son, and you always had the grandpa character. There are no grandpas or grandmas on TV anymore.
Exactly. Yeah. You have the Kardashians.
Yes.
You know? So, and you know, the other interesting thing is a lot of those reality stars, they are undergoing plastic surgery themselves and they're talking about it on TV. And so more and more people are then intrigued and, you know, they don't necessarily see it as something that only Hollywood stars do. They're seeing it as, you know, something that an everyday average suburban housewife would be interested in.
Okay, can somebody actually get addicted to plastic surgery? I mean, every once in a while we hear these stories about people who want to be a real-life Barbie doll or something like that.
Sure, and there are patients like that. And I think, you know, as a plastic surgeon, it really is your job to kind of educate your patients and also to let them know when enough is enough, right? Because, I mean, you can kind of continue going on and on and on, but at some point you have to stop, and it isn't safe.
Let's talk about body shaming, because there's a lot of talk about that right now. Do you run into patients who, you know, somebody said something on Facebook and now they're mentally scarred?
And, you know, we have actually had one patient who came in because of that, who just felt really bad about the way she looked because she had kind of been tormented about her nose appearance ever since she was a child. And it's one of those things where you want to obviously help someone, and you want to. It's a surgery that, you know, we can do and we can fix their nose, but you also want to make sure that they don't necessarily put all of their kind of eggs in one basket, that they expect just by getting a nose job that all of their life's problems are going to be solved.
Right.
And so I think it's a very fine line when you walk that, because you have to say, okay, well, I can fix this. But, if you still feel depressed or if you have low self-esteem, there are also other things that you may need to do.
One of the things, obviously you're a brilliant plastic surgeon, but you're also a very nice person.
Well, thank you.
I think that's a big part of, the rapport that a patient has with her or his doctor is important, isn't it?
Sure. Yeah. Our patients really become kind of like a family. And I run into my patients, at the grocery store, at the mall, and it's fun. We get invited to their parties, to their birthday parties, to their kids' parties. So our relationship with our patients is definitely special.
Has plastic surgery gone from something that nobody talks about to now they brag about it?
I think it's a lot more acceptable, and I think you can, I don't know if you can brag about it, but you can definitely talk about it in the open, and there's no shame.
Yes, and I think that's part of what you said about reality television, that, we see these stars talking about it. It makes it more acceptable, doesn't it?
It definitely does, yeah. And I think it also makes it more acceptable. There are people out there who are saying we don't want plastic surgery, and so it's a good conversation to have. People are talking about it.
Okay, we've only got 30 seconds left, so give us the website.
Okay, well, our website is just Con Plastic Surgery. We're on Twitter at Con Plastic Surge. We're on Instagram, Con_plastic_surgery. We're on Facebook, Con Plastic Surgery. So you can find us all over. And the old-fashioned phone is 14694 for Dr. Con.
Awesome. Well, thank you so much for being on the show.
All right. Well, thank you so much for having me.
That's
Enjoyed
today's
it.
show. We'll see you next week.